everyone, and welcome back to another anatomy video. This is Dr. Ahmed from the Veterinary Anatomy channel. In this video we will talk about the pectoral muscles and the long muscles of the neck in the dog. So let's get started. Guys, as you can see here, we remove the skin. I need you to understand the position. We are looking at the ventral aspect of the dog. Here is the head, as you can see. Here we have the two forelimbs. This is left and that is right. And in this video we will talk about the anatomy of the pectoral muscles. After that we will go to the neck area in the ventral aspect or view here, describing the long muscles of the neck. So let's start with the pectoral muscles. In general, there are two pectoral muscles, guys: superficial pectoral muscle and the deep pectoral muscle. Further, the superficial pectoral muscle has two parts, also the descending pectoral muscle and the transverse pectoral muscle. So let's start with the descending pectoral muscle. This one here, as you can see, guys, it's very clear. This here and that one here, these two parts. So the origin of this part is from the manubrium sterni, or the cranial part of the sternum, which is the manubrium sterni here, and the insertion is to the cranial surface of the humerus, while the transverse part of the superficial pectoral muscle, which you can see here and there, is actually a huge muscle. It doesn't start and ends here. It's located under the descending muscle. Can you see? This is all part of it. This is all part of it. So if we go here, we can understand that the descending part is located on the transverse pectoral muscle. Okay? So the transverse pectoral muscle, as you can see, originate also from the cranial part of the sternum, just behind the origin of the descending pectoral muscle, inserts also to the cranial surface of the humerus, cranial surface of the humerus here and there. And both of them are innervated by the cranial pectoral nerves, which comes from the, of course, brachial plexus. So this was the superficial pectoral muscle with two parts, the descending part and the transverse part. Moving to the next muscle, that one we can find in this area here. In this area here, called the deep pectoral muscle. Of course, we have one on the left, one on the right. And the deep pectoral muscle, as you can see, originates from the sternum all the way from the beginning to the end somehow. And if you follow the muscle, it goes there. What do we have there? Actually, it inserts to the greater and lesser tubercle of the humerus. It's more on the lesser tubercle of the humerus, but we found always that the part of this muscle can also move to the greater tubercle of the humerus. So this is the insertion of the pectoral muscle, deep pectoral muscle. In the dog, as we described in previous videos, sometimes you will find also that the deep pectoral muscle has the principal part is this big muscle here and an abdominal part. So this one comes, it's a thin muscle, comes from somehow from the end of the sternum, so it belongs also to the deep pectoral muscle. Okay, so this was the deep pectoral muscle. The deep pectoral muscle is innervated by the caudal pectoral nerves, which come from the brachial plexus. So this was the pectoral muscles, and now we will move and talk a little bit about the muscles which we can find here in the neck area, or we can name them as the long muscles of the neck. Starting with the most superficial located one. So we have always paired muscles, yeah, left and right. So this muscle here, called the sternocephalic muscle, from the name, guys, Sternocephalic, that means it originates from the sternum and exactly from the manubrium sterni, moves all the way to the cephalic, which means head. So sternocephalic. The sternocephalic muscle has two parts. So if we look exactly at this muscle here, let me just show you. I will remove, what was this? This is the external jugular vein. External jugular vein. So if we move to the side like this, you will find that the sternocephalic starts as one muscle from the manubrium sterni, but at the level here, it's divided and gives two parts. Or maybe I can put it to this side, yeah. So two parts. The first part moves toward the mastoid process, and that's why we will name it the sternomastoid muscle. Sternomastoid muscle. So from the name, guys, origin is the manubrium sterni, insertion is the mastoid process. The second part here is the sterno-occipital muscle. Sterno-occipital muscle. Why occipital? Because if you follow the muscle here, you will find inserting to the occipital bone. So sterno-occipital muscle. From the name again, origin, insertion, the manubrium sterni, and the insertion is the occipital bone. Okay? So this was the first muscle which we can see here after removing the skin. If we dissect the muscle and put it to the side a little bit like this, you will find another two muscles. They are relatively big muscles moving on the ventral surface of the trachea. Can you see the trachea there? This is the trachea. So if you look at the origin and insertion of this muscle, you will find that this muscle originates also from the manubrium sterni there. So from the manubrium sterni, that means from the sternum, and they move all the way and inserts on a small bone found here, which is the base, the base hyoid bone. The base hyoid bone, which is part of the hyoid apparatus, of course, yeah. So the insertion of this muscle is the base hyoid bone. So again, put the origin and insertion together, you will get the name of the muscle. So from the sternum to the base hyoid bone, that means this muscle called the sternohyoid muscle. Sternohyoid muscle. We have one on the left, one on the right, as you can see. So I can put them here, and you will understand what I'm talking about. So they insert both left and right on the base hyoid bone. Now if we dissect these muscles and move them to the side, guys, you will find another two muscles on the trachea. So I will show you in two different views, yeah. I just put the other muscles to the side. Can you see these two muscles here? They are also another two long muscles of the neck. If you follow them, you will see them also starting from the sternum, moving all the way here and inserting to the thyroid cartilage of the larynx. So this is the larynx here, I will show you later, and this part exactly is the thyroid cartilage. So this muscle starts, yeah, I will show you again. This muscle starts from the manubrium sterni, moves all the way to the thyroid cartilage of the larynx, and that's why we will name it as the sternothyroid muscle. So this here is the sternohyoid thyroid muscle. Again, yeah, this is the sternohyoid. So this is here the sternothyroid muscle. Sternothyroid muscle. Okay. So in general, guys. It's easy to remember this muscle. So we are talking about three muscles on each side. from superficial to deep or from lateral to medial if you want. So we have outside located superficially the sternocephalic muscle with the two parts. After that you will find the sternohyoid muscle, and finally you will find the sternothyroid muscle, this one and that one. And if we put them somehow in a nice place, of course it's not 100% natural, so you will find them all together, and you may be able to do screenshot and keep it for your information. Yeah, so from outside to inside, on each side we have the sternocephalic, sternohyoid, and sternothyroid. And it's very easy here to remember or to guess the origin and insertion from the name of the muscle itself. So of course after that we have the trachea here. Here, if you look exactly, you can also guess that there is something special here. So this is the larynx, and we can see some of the laryngeal muscles here, which we are going to describe later. Two structures are the mandibular lymph nodes. If you remember, we said that the mandibular lymph node is divided in carnivores into two parts. Yeah, can you see? This is one, this is another one. On the other side, we have the same situation. So this is the two parts. Here, it's the mandibular lymph nodes. If you go deeper there, you can find the mandibular gland. This is the mandibular gland. Can you see that? Very interesting. You know, mandibular glands, it's a salivary gland, of course. What else can we see here? We mentioned this before. So it's the external jugular vein formed by the maxillary vein and the linguofacial vein. We have the mylohyoid muscle here. We have yeah, this is the other external jugular vein there. And now I have a question for you. The first question which I would like to ask you about is, in the depth there, in the depth next to the trachea, left and right, I can find very important structures here. Very important structures. As you can see, there's a very, big artery there. Next to the artery, there's a nerve. And these two structures are kind of structures which we are not allowed to forget the name of them. They are very important. So the first question is, what is the name of this artery and the name of the nerve moving next to it in the depth there next to the trachea? Please write your answers in the comments. I will wait a little bit, and after that we can discuss, you know, the answers together. Do we have another question? I believe this is okay for now. So only one question for this video, guys. Please share this video with your friends. It's very rare that you will find a video describing these muscles, because only the position of the dog is not comfortable, of course, not for the dog, not even for the anatomist. So share this video with your friends, and if you have any questions, write them in the comments, and I will see you very soon. Bye bye for now.